These people have been queuing for hours to sign up to Ghana's National Health Insurance Scheme. A new instant biometric membership card is proving very popular. The scheme was introduced 10 years ago, and there are now more than 10 million subscribers. It means access to free healthcare and medicines for those most in need. VIDA KLAUDIASU is waiting for her child to see the doctor at the country's largest hospital, Kolebu. She's been using the National Health Insurance Scheme for 7 years. She says it's been of real benefit, but is not efficient.
At times you can get here at 8 a.m. and then you have to go to the insurance desk, fill out forms. All these waste time. And sometimes it's 1 or 2 p.m. by the time you get to see the doctor.
As the scheme grows, it faces major funding challenges, and it's being compounded by Ghana's deteriorating economic situation. The government hasn't paid its bills to those providing the service. This is one of the busiest pharmacies in Accra. They serve nearly 3,000 health insurance patients every month, and they haven't been paid by the government since the beginning of the year. It's a similar story for this private clinic in Tema, just outside the capital, Accra. The medical director says he's struggling, but he continues to see health insurance patients because he doesn't want to abandon them.
It's very difficult for us financially because the last payment was about some 5 months ago, and we haven't paid our salaries. We have a lot of interest to pay in banks.
The boss of the National Health Insurance Authority says the government is committed to paying those providing the service, but that the scheme was too ambitious to start with.
For a lower middle income country, it's quite challenging. Challenging, one, because our benefit package appears to be quite huge, covering over 95% of disease burden in the country. Perhaps in hindsight, we could have begun with a more modest benefit package and increasing this package as we got along.
The scheme is financed by a national insurance tax of 2.5%, plus an annual flat membership fee of around $6. It's won international recognition for bringing free healthcare to millions. However, critics argue it's not sustainable and that it's hard to see how the service can remain viable unless people pay more. Ama Boateng, Al Jazeera, Accra, Ghana.